Medurstand-Understanding Medicine.
Professor Aziz Rehman from Medurstand, and I'm going to demonstrate how to test third cranial nerve. Third cranial nerve or oculomotor nerve. Now this is the nerve which comes from the brain stem. We have got two of them. One supplies the right, the other one supplies the left eye, and it has got multiple functions. I think first of all it controls your pupil size, because the muscle which leads to constriction or dilatation is controlled by third nerve. Then it also has a role in controlling the eyeball movement, and that we will actually test in when we test all three, third, fourth and sixth cranial nerve in the movement, ocular muscle movement. And then one function is the upper lid. So if the third nerve is paralyzed, the upper lid may be, there may be ptosis. So let me demonstrate how to test pupil reflex. This is, I think, the commonest question asked in both undergraduate as well as postgraduate examination. So you need to have a torch, a good quality torch, or maybe you can use your mobile phone, because all mobile phone these days they have this built-in torch. So I'm going to use this conventional torch. So both eyes should be tested separately. First of all, just look into the eye and see the pupil size. Both pupils should be of moderate size depending upon the ambient light. If the light in the room is low, then the pupil is likely to be slightly bigger, and if there is too much light, the pupils are likely to be smaller. But both pupils should be of the same size and normal shape. So after making sure that the pupils are both are okay, so I'm going to test both eyes separately. Let me cover this eye first and do this one. So I think the technique is, we put the light on and move the light into the eye, bring it from outer side to the inner side, like this, and udhar dekhte jaye, like this. And we have to do it 2 to 3 times to make sure that our observation is correct. Every time I shine his eye, the pupil constricts. So this is the normal reflex. Now I'm going to do it on the other side, cover this one. I'm constantly looking into his eye, and I think there is normal reaction, pupil constricts. So from pupil reflex point of view, both third nerves are okay. Then there's something called consensual reflex. So that is, if we block this like this, and I am looking into the right eye but will shine his left eye. In response to this, there should be some constriction of this pupil also. And if I do the other side, again, when I shine this eye, the other pupil should also constrict. Of course, not to that extent. When we shine eye and the same pupil will constrict more vigorously, but the other pupil should also constrict slightly. This reflex should also be intact if somebody has got absolutely normal function. As far as ptosis is concerned, I can see, I think there is no ptosis. If third nerve is paralyzed, there may be ptosis. That means one eyelid is maybe paralyzed and it is covering the eye. Depending upon the level of ptosis, sometimes there may be very mild ptosis, we call it pseudotosis actually, and there may be complete drooping of eyeball, this eyelid. So that could be a sign of third nerve palsy. And since third nerve also supplies many extraocular muscles, so eyeball will also be rotated or medially deviated. When I shine the light here like this, light should fall on the same part of cornea in both eyes. Udhar ko dekhe, again corresponding part now the conjunctiva, but same, idhar ko dekhe, right. So I think whichever direction patient sees, both eyeballs move in the same direction with the same degree, and that I can verify from this light reflex. Of course, if there is third nerve palsy or any other nerve palsy, patient would also develop diplopia. So in cases of third, fourth or sixth cranial nerve palsy, when we examine eyes, we are doing actually two things. Number one, we are looking at patient's eye and making sure that both eyeballs move in the same direction and by the same degree. And at the same time, we are also asking the patient if patient vision is double. ये देखें ज़रा, आपको ये एक लाइट नज़र आ रही है, एक है ना? अभी कितनी है? इधर देखें, अब कितनी? अब देखें, इधर देखें, अब कितनी? एक. So in all directions, I have ensured that eyeballs move, both eyeball moves appropriately in the direction to which I take my light and by the same degree. And the light which is reflected back from his conjunctiva and cornea, it corresponds to the same part both eyes. So that will tell me that no nerve, third or fourth or sixth nerve is paralyzed, and he did not develop diplopia at any side. So that also confirms that all three cranial nerves are okay and extraocular muscles are okay. Thank you.